Hello, podcast listeners. My name is Elizabeth Hodges. I am a student in Applied Health at the Brigham Young University of Idaho. This podcast is for healthcare workers, hospital patients, and visitors. It emphasizes two key points to help prevent infections: the importance of practicing hand hygiene while in the hospital, and that is appropriate to ask or remind healthcare providers to practice hand hygiene. On average, healthcare providers clean their hands less than half of times they should. On any given day, about 1 in 31 hospital patients has at least one healthcare associated infection. One of the biggest roadblocks to improving hand hygiene among healthcare workers is their unawareness of low compliance rates. For example, North Shore University Hospital in Manhasset, New York, used an objective monitor system that provided constant observation and feedback. However, it found the rate to be less than 10%. Even if staff are aware of low hand hygiene compliance rates, they may not feel an urgency to improve adherence because the consequences, infections of death, may not be obvious unless someone dies. They think it's not a problem. While most healthcare workers understand the importance of hand hygiene, they may not be aware of the correct techniques and times for hand washing. While staff and employees know of hand washing, there is still plenty of room for educating residents about the importance of proper hand hygiene. Healthcare providers might need to clean their hands as many as 100 times per 12-hour shift, depending on the number of patients and intensity of care. Practicing hand hygiene is a simple yet effective way to prevent infections. Cleaning your hands can prevent the spread of germs, including those that are resistant to antibiotics and are becoming difficult, if not impossible, to treat. When you are a patient or a visitor, you may get bad germs on your hands from things you touch. Clean hands often to get rid of these bad germs, and it's okay to remind healthcare providers to practice hand hygiene. Healthcare leaders need to educate employees on infection control practices, including hand hygiene, beginning at orientation, especially the proper method to washing and keep hands clean, gloving before touching patients, and sanitizing throughout the day after interacting with other residents or contaminated objects needs to be an ongoing discussion. The continuation and enhancement of education among staff, residents, and visitors about proper hand hygiene is key to addressing this issue. Let's all be part of the solution. Wash hands and save lives. Thanks for listening. Please visit Centers for Disease Control and Prevention at cdc.gov for more current health information.